You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Dank, veterinarian oncologist with HTVET, a company with a mission to provide non-invasive tests to rule out cancers. Welcome, Dr. Dank.
Hi, thank you very much for having me.
Well, I wanted to find out, what is HTVET and how can you help our listeners?
So HTVET is a company that has a very exciting device. The device is called Vista, and it's the first non-invasive medical device that allows veterinarians to rule out cancer on the spot in their clinics.
So if I bring my dog into a veterinarian clinic, what would happen if they suspected that she had cancer or he had cancer?
So what would happen now, before this scanner, is that in order to find out whether your dog has cancer, a veterinarian would have to diagnose the mass. And that means that they would either have to do a fine needle aspirate or a biopsy. And both of these are invasive procedures that sometimes they can get an answer on the spot, and sometimes they have to send that out to an external laboratory. And what this does, what the scan actually shows, is that it heats up the tissue, and then tissue cools down. And what turns out is that based on the response of the tissue to this heating process, there's a difference between malignant and benign tissues. So just based on the scanner, we can know whether your dog actually has a benign tumor or some kind of tumor or inflammation that requires additional diagnostics and workup by your veterinarian on the spot.
Wow, that's amazing. How long does the exam take?
It only takes about 2 minutes. So when you want this test to be done, you can come to your vet. The vet has to clip the area that is questionable, and then they put the scanner on it. The scan works for about a minute. The tissue is heated up for about 10 to 20 seconds, and then it cools down. Then all of that information goes up to the cloud, and within 2 minutes, you have an answer back.
Oh my gosh, that is going to be life-changing for dog owners.
We certainly hope so. It's really amazing and very exciting.
I have a overweight black lab who she has her back leg swells, and last summer I took her to 2 different vets and they said that she had cancer. And I actually was back in Illinois where her original vet was. So I went and stopped and saw Dr. Brown, and she's on my podcast regularly. And Dr. Brown said, no, I don't think it's cancer. I think it's some type of flare up. It's like right in her joint in her back leg. Well, it's flared again. And I just went to the vet, and just what you were talking about, they had to do an x-ray, and she couldn't really see whether or not it was cancer. So then she sent it to a specialist, which took 2 weeks. And so anyway, this is amazing.
This is exactly the kind of test that I know that a lot of people are worried about dogs that get older, and then they take them once in a year, hopefully for a geriatric checkup, which can include blood work, can include abdominal ultrasound, thoracic radiographs. And this is another test that people can use as their dogs get older because cancer is so common. And then they can know, okay, my dog has all sorts of lumps and bumps, and I know that they're all okay and benign, and I don't have to do anything, and I can be okay with that. Or they can also find out, okay, my dog has 3 or 4 or 5 lumps, and it might be that 4 out of 5 are absolutely fine and benign, and there's only 1 that we have to continue to diagnose and possibly treat. And it's very, very helpful for dogs and their owners, of course.
So it's almost like a body scan. Is that?
It checks where you want to check. So it's not like it'll check the whole body, but obviously if a dog has multiple masses, we can check wherever you want.
Yeah, so like also with my fat little lab, she is riddled with fatty tumors. Mm-hmm. So you would be so my vet would be able to take this scanner and scan the stomach area where there are a lot of lumps.
Exactly. So you could check every single tumor that you think is a fatty tumor and make sure that indeed it is a benign tumor, and that it isn't that she has, let's say, 10 tumors and 9 are fatty tumors, which are called lipomas, and 1 might be something else that is more worrisome. So the fact that older dogs get lipomas is something that everybody knows, but it's not like if a dog has 3 lipomas that the 4th is going to be a lipoma too. So every single mass on a dog, especially older dogs, needs to be checked.
So how long has this technology been available? Did you just invent it?
So it's been out there. The company has been around for a couple of years. The first time that we presented an abstract was at the Veterinary Cancer Society in 2020 with the pilot study that we did on 50 dogs. And then the second time that I presented an abstract was at the European Veterinary Cancer Society in May of this year. And since then, we're still accruing dogs for more and more research, and we've already used this scanner on over 1,000 dogs.
And so I'm in the Colorado area. Do any of the veterinarians in Colorado have the scanner?
It's just come to the United States within the last couple of months, and I don't know exactly where there are different clinics, but I'm sure that within a very little amount of time, any veterinarian that wants it will be able to get their hands on one and start using it.
So can you tell for both our listeners and the veterinarians that listen to the podcast on how they find out more about HTVET?
So, of course, in the United States, the distributor is Companion Animal Health. So I'm sure that if they look into their website that they can get in touch with them and check about how to order. Or they can also look on our website, which is called HTVET.
Well, this is absolutely amazing. I know even just going 2 weeks ago with Maddie, they wanted to, stick a needle in her back leg to, see if they could get fluid. I mean, this will be a game changer for both pets and owners.
That is certainly the purpose. And we know that a lot of people all over the United States are kind of worried about, I'm taking my dog in and he has a mass, and do I really want to let the doctor or the veterinarian aspirate it, because they're a little worried about aspirates, even though up until now that was the best way to diagnose them. And so this is a way for animal owners to come in and say, okay, I want you to check out all of the dog's masses without any aggressive procedures, and then we can just continue to diagnose what we need to and not everything. So it's a way to give people an easy test, easy for the dog, easy for the owners, which can give them a great deal of information. I just think it's really important for anybody who has older dogs to bring them into your vets, to have geriatric checkups, and to make sure that every lump and bump gets diagnosed so that you know if everything's okay or whether they have to continue their workups.
Yeah, I mean, technology seems to lag in veterinarian clinics. So, this will be great.
There's no question that everybody is afraid of getting new technology, new medications, and it's hard for people to kind of look at new stuff and say, wow, we're going to bring it into our clinic. We're going to have to learn how to use it on a daily basis when we're so used to working the way we've been working for 10 or 20 years. But we hope with encouragement from clients that people understand that they can get this scanner and use it as much as possible.
Wow. Well, thank you for being on the podcast, and we look forward to having you back.
My pleasure. And I hope that everything's okay with your lab.
Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.